Welcome to the LGBT Mummies Tribe series features. We have the amazing Dr. Venkat with us from the Harley Street Fertility Clinic in London. Welcome, Dr. Venkat. Thank you for joining us.
Thank you very much for introducing me.
No
it's a
problem.
great pleasure to be on this program.
Brilliant. Thank you. So for all of our tribe, it'd be really interesting if you could introduce yourself and explain a bit more about the clinic before we go into the questions that people have asked us to ask you.
Thank you, Laura.
No problem. Did you want to explain a little bit about the clinic and who you are and what you do and how long you've been around for?
Okay, thank you. So we are Harley Street Fertility Clinic located in Harley Street, and I'm the director of Harley Street. We started the clinic in 2010. It was a small organization with 3 people at that stage. One nurse and 1 receptionist and myself. And now we have got something like 35 staff in our clinic, and we are doing more treatments. That means we are seeing more patients, and the clinic has progressed in all the ways, not only seeing more patients, doing more treatments, and we have our own lab in our clinic. Initially, when we started, I was using some other clinic's lab, so I was taking patients there, and I also went there to do the procedures. But now we have our own lab for the last 6 years, and it has been doing very well, and our success rate is excellent. That is the most important thing for the patient. But our clinic is also well known for the care we offer to the patient. We don't call it treatment, we call it care of the patient or looking after the patient. So I know this because some of the patients who got pregnant, even after pregnancy, they say that only thing we miss is coming to the clinic. And even during their pregnancy, they used to come and sit and have a coffee, even when they are 30 weeks pregnant, 35 weeks pregnant, because they feel so secure in our clinic, loved by all the staff. Yeah. They feel that it is their second home. So that's how our clinic, and I am happy that we are able to offer this service to the people, and they are happy. We also treat, different kinds of people in the sense like heterosexual couples, same-sex couples, and male same-sex couple. And we have had quite a few people who changed their sex, transgender men and women. We get, especially from Europe and other places, because in some of the countries it's not allowed. And so some of the spokesperson for all this transgender group have come and had their gametes frozen in our clinic, and all of them describe their experience or journey as a very enjoyable one. I mean, in the sense, as much as you can say. And I'm very grateful for that we were able to provide. So I hope the people who have come to attend this webinar today will benefit from our clinic's services, Laura.
It's very important though, isn't it? It's such a special journey, starting a family, so you want to use a clinic whereby they look after you and care for you and are compassionate about how you go through your journey. So it's great to hear that you've had people have such good experiences with you.
Thank you. Thank you for your kind words.
We've got quite a lot of questions, so I'm just going to go through them now. So if you can just explain for the rest of the tribe what kind of treatments that you offer for the LGBTQ community, so same-sex couples, transgender, non-binary, lesbian and bisexual, what kind of treatments do you offer currently?
Okay, so we offer different kinds, whichever suits them. Basically for same-sex couple, women, we offer donor insemination. That's the simplest treatment because they are not infertile women. Therefore, we offer them simple treatment, that is the insemination with donor sperm. And now that when I started my career, that was the commonest treatment for the same-sex couple. But what is that? Sorry about this. There was some echoing. Yeah. So I just want to repeat it. Recently, things have changed a lot, and because people knew that the success rate with donor insemination is not great, Therefore, they want to increase their success rate and get pregnant in the shortest interval. More and more women wanted to embark on IVF treatment. And we also have a program called Egg Share. Here it is a very useful one for people who can't afford IVF. In private clinic, of course, it is expensive. It's not very cheap. It's something like £6,000 to £7,000. And there, what happens, it's not only for purpose of the money, it is also another altruism involved here. Some people, some same-sex women, they want contribution from both the partners, which is interesting, so that they feel that we have done our best for the baby. And one person uses her eggs, the other person uses the uterus to carry the baby, which is a nice arrangement, I think. And when they do this treatment, the person who is using her eggs, if she has got good number of eggs and if she's under 35, we also do what is called egg share program. That means she not only donates, gives her eggs to her partner, she also donates to another person. So they are so happy to help somebody else along the way. And it's something so positive. And these girls, I've seen all of them enjoyed that because they are using some sperm donors, altruism. They said, look, let's give something back to the community. All of them did that. And I will also say very happily, all these people have been successful. I always say the same-sex couple are not infertile usually. And when they take part in such a program, they have a baby and they give a baby to the other one also. In all our cases, it has happened, which is a nice arrangement. And these, girls acting as donors is such a blessing for the ladies who need the donor egg. So we do that. And then, of course, bisexual men, whatever treatment, or bisexual women and partners, whatever it is, then we give appropriate treatment to them. And we also have gay men coming for treatment, and they use surrogates to carry the baby for them. A few years ago, all the gay people were going to USA because it was difficult in this country to arrange the surrogacy arrangement. And also it was difficult to find egg donors. So because they need egg donors as well. So now the rules have changed for surrogacy and things are better and easier. So we treat the male same-sex couple with donor eggs as well as with the surrogate. It's a beautiful arrangement. And we have had some patients coming and crying with the baby because some men, we think that men don't have emotion. And when they came with the surrogate for pregnancy test, they were all in tears, hugging together. It was such it's such a wonderful feeling. And when they had the baby, they brought the baby to our clinic and showed us. It was a very nice arrangement. And transsexual, men and women, we have frozen their gametes, either sperm before becoming trans women or, egg before changing sex into the other side. So we have arranged that. Like I said, they have all had good experiences in our clinic. And the main thing is we respect them, treat them as, our guests and look after them in such a way. Our staff don't react in any way different to the other couple. And we treat them well. And we use the language which they would like us to use. We are all careful about it. That's very important because, yes. And so they are all trained to do that and respect them and at the end, they go home happily because our success rate is good. And we do our best from both sides, clinical sides and looking after them. And we do all kinds of, treatment, egg freezing and everything. So, and egg freezing also, if they have good number of eggs and they are under 35, we can also help them financially by allowing them to take part in the egg share program, which some women have done. Women have done that because they wanted to freeze the eggs and they gave half the eggs to somebody else and froze half the eggs. That way they are helping another couple also. So all their journey has been very good and they really liked it and we looked after them. And most of the cases have been successful. So I'm really happy and we welcome you with both hands.
Brilliant, brilliant. So in regards to, you spoke about IUI, you spoke about reciprocal IVF, about treatment for trans and non-binary people. One of the followers on Instagram asked, what preparation should a woman or person be doing in the lead up to IUI? So what would you advise that they should do to ensure success resulting in a pregnancy?
Yeah, good. That's a good question, Laura, because everybody would like to know how to prepare themselves. That is true. And we all say, look, it's important that the person who is going to have the treatment or the insemination takes folic acid. It's not only when you just start the treatment, because you're advised to take it periconceptually. That means 2 to 3 months before. So I would like all of them to start taking folic acid 400 micrograms. You can buy it from any chemist or even supermarkets. It's all the same. You don't have to go for the highest brand or anything like that, highest cost. It's all the same. And if you want other vitamins along with that, you can go for something like Pregnacare Prenatal, which contains vitamin B, B12, and other things as well. And when they come for consultation, what we do is we advise them to have a fertility checkup, because we know that they are going to have donor insemination, but at the same time, it is good to have a basic fertility checkup to know that everything is okay for them. And because sometimes we have surprises and we don't want to be doing the treatment that is not optimal for them. Therefore, we do the basic fertility checkup. So that's what the couple need to do. And if they want to do some of the tests with the GP, they can do that and we can accept those, provided they are quite recent within the last 3 to 6 months. If they are more than 1 year old, then we say sometimes it can change, it's better to repeat it. So we do the fertility checkup, which includes scan to check the uterus and ovaries to make sure these organs are structurally normal, and all the hormones. I would also mention that one of the hormones which is not usually checked in the NHS, I'm not criticizing them because of the lack of resources. I think the GPs are not able to do the AMH test. The AMH is the critical hormone as far as people like us are concerned, because we want only the number of eggs. That is our slogan, you know. How many eggs have you got? That's what I want to know, nothing else. But that's what is missing there. So AMH gives us the number of eggs. As long as you have lots of eggs, you have power in your hand, because that is the one which increases your chances and increases with the IVF or IUI, everything. And those who are going for donor insemination, there is one more test we do. That is called checking the fallopian tubes. It's done by a simple test called the HSFC. We put a small white dye through the cervix, do a scan to see if the dye goes through the fallopian tubes. This is important because without this, there is no point in doing insemination. Because if the fallopian tubes are blocked for some reason, then the sperm and the egg cannot meet, and putting the sperm inside is of no use. So we will be wasting their money. That's why we tell them to do the test and then arrange the treatment. After all, doing the insemination is easy and simple. As I said, it is like a smear test. We just pop a speculum, visualize the cervix through a thin plastic tube. We use the prepared sperm and put it inside. So when I say prepared sperm, it's not a simple thing. We take the donor sperm out of the freezer, and it takes 2 hours to prepare the sperm. And then we prepare it, take all the fast swimmers and put them inside. Okay, so that's why. And we do it at the ovulation time. It can be done with a natural cycle. That means without any medication. I mentioned earlier, this same-sex couple or not infertile couple. They don't need medication. They can use their natural cycle and they develop a follicle, release 1 egg. So let's make it natural. So go with the natural flow at the right time when they are about to ovulate. Then we plan for the insemination to occur, and then we do the insemination. So if everything is favorable, then things happen. But only thing I want everybody to remember is the success rate with insemination is not very high. So don't get too disappointed if it doesn't happen in the first attempt. you might have to do one or 2 or 3 attempts. Of course, if it doesn't happen then also, then we have to think of other strategies. Okay.
It's great that you said about 3D hypoxia, because I've had 2 of them. They're rather painful, but they, they're really painful. But it's so important, and I think that I've known people that haven't had them and have had treatment that's been unsuccessful, and then they've had it to realise the tube's been blocked or that they have issues. So it's great to hear that you're forward thinking and you're saying no, this is something that you really need to do to ensure that you have those free tubes. So it's great that you said that.
Yeah, it is, because otherwise we are wasting your time and wasting your money as well. That's not right ethically. So we have to follow the correct steps. You are right, Laura. Thank you for that.
In regards to home insemination, if you want to talk around that, because we get a lot of questions from people that are considering home insemination, but also considering using a clinic, and they're kind of torn. Obviously, we know that the HFEA in the UK advise against it. However, we know there are thousands of women and people in our community that have had it successfully, which is amazing. But it'd be great to understand from a clinical perspective for yourself why it cannot be advisable at times, just so people can have an informed choice from a clinical perspective.
Yes, again, it is an important question, because like you said, a lot of people, when I see them in the clinic, they always say, oh, we have had 6 cycles of home insemination. It has not worked. So we hear that. But that is their choice. We don't say anything about it. And especially if they have a known donor, it becomes easy for them. And what happens is some of these, they happen to be friend and everything, and they do the insemination. Some of them are not tested. So we don't know if the sperm donor is carrying some infection, even simple infection like chlamydia or something, or other major infections like hepatitis B, HIV. You may not know that. We are saying donors should be tested to protect you, our patients, our clients. That is the main thing. That's why we say you have to be careful in home insemination, because the donors are not tested. And nowadays there are places where they do home test, I believe, for HIV and other things. I will be a little bit sort of scared about it, because we do not know how accurate they are. And there is so much of, even in the clinic, we say that, look, you do one test before freezing the sperm. We do the test, repeat it again to cover the latent period. So the test may be negative, but he may be carrying the infection, because if during the latent period, the test does not reveal the correct answer, positive result. Therefore, the test may not be good, and patients may catch infection through the semen or the sperm insemination. But there is also another important thing. You must, because we think, oh, he's our friend, oh, he will come and see the baby whenever we like or something. No, if the relationship becomes bad, then there can be major problems with it. Say you probably think, okay, we want so much involvement from the donor, and he might think something else. He wants more involvement. Probably the couple are not aware of that. And later on, there will be misunderstanding. Main thing we are worried about, it will be bad for the baby. It's the welfare of the child. It is very important, because at the end of this, our misunderstanding leads to problem for the baby. And the baby will suffer from all these arguments and interactions with people. Therefore, we say, look, in the clinic, we have arrangement, we have a solicitor. We say if it's a known donor, get a form, called contract to sign with the donor. Say how much of involvement you want the donor. And sometimes they also have what's called co-parenting and other things. Yeah. And so you can do to any extent, as long as both sides understand it. And also when time changes, people change. And they might say, oh, I thought we said this, you said that. This is all from memory. And people remember what they want to remember. Therefore, it's better to put this in writing and have a contract signed. So that is another thing with the home insemination. Yeah. And as I said, home insemination, the success rate is not great compared to the clinic insemination, because this is not a prepared sample, and it is just introduced into the vagina like an intercourse. That happens. Doesn't mean people don't get pregnant. It has happened. People do get pregnant. But the success rate here in the clinic is much better because we prepare the sample, we take all the fast moving one, remove all the dead sperm, and place it higher up in the uterus, not in the vagina, not in the cervix. It is only prepared sperm can be introduced into the vagina. And because it placed close, I always say, look, the sperm has to travel from Brighton to Scotland. Okay.
It's a good analogy though, so people can understand.
Yes.
You know, how far it to go.
Yeah. But we put it near, you know, I don't know, Dundee or somewhere near, then it's not a long way for the sperm to go. Because we think, oh, it's only 5 centimeters, not very long, but what is the size of the sperm? Microscopic structure. That is why we make the journey easier for the sperm. And it doesn't have obstructions like, you know, what we can say, checkpoints like cervix and others where they are all filtered. They are all sent home, you see, and we don't have all that. So we put it high up, it goes straight into the tube to meet the egg, and success rate is better. So that's how I think we have to look at it. It's better, if you want to do things properly, it's better to do clinic insemination, but some people want to keep things simple and do it. And emotionally, I think it's easier for them, but they must understand there is a risk in that. That's all I would say.
Of course, I think it's good to have the open conversation, because obviously we have lots of women and people who have successfully had babies at home, and they have the known donor involved, or they don't, or they have agreements. But this question specifically came from someone that wanted to know the positives and the negatives so that they could make an informed decision on clinic or at home. So it's really good to get a clinical view of that for that specific person that asked. Thank you for that.
Thank you.
The next question, more information about IUI. So you've got a seminar coming up, haven't you? So I didn't know if you wanted to talk about that.
Yes, we are going to talk about donor insemination for the same-sex couple, single women, or who, you know, such people who want it. And we do look, we all say, oh, it's IUI. No, it's not. Its success rate is something like, it varies between 10 to 25 because it, like I said, depends on the age of the woman and quality of the eggs, and also make sure the tubes are open. And if you have good number of eggs, and we give you, you know, like we make, depend on the egg which is released that month. So the chances vary, the success rate varies according to the age of the woman and your quality and the lifestyle also. Yeah, because the lifestyle things in activities lead to the quality of the eggs. That is, if you are like, if you smoke or drink, the quality of the eggs will not be good. But otherwise, if you lead a healthy lifestyle, the egg quality will be better and the success rate will be better. So the success rate varies according to so many factors, but it is not high like IVF treatment. Having said that, we are not comparing the like with like in IUI and IVF, because IUI is a very simple treatment, more natural treatment. Fertilization takes place inside your body, in the, you know, whereas in IVF, everything is artificial, more unnatural. Fertilization takes place outside the body, in the laboratory. We take your eggs out, the term, mix it, and then we grow the embryos outside, put the embryo. So it's more involved treatment, complex treatment, success rate is better, and it's also more expensive. That is why I can't compare it. So people, especially same-sex couple, I believe they are normal in the sense, not infertile couples or infertile people. So they don't have to jump onto IVF if they don't want to. If somebody says
they have issues, because there are women or people with PCOS, endometriosis, blocked tubes, etc. But in the case of ones that aren't,
if there is no medical indication to go for IVF, they can do this. But if somebody tells me, look, I want a baby on fast track, then I will ask her to go for IVF. Fast track means because it gives you the highest success rate. And the success rate with IVF is something like 50 to 60%. Whereas with IVF, it's only up to 15 to 20% on average. That is the difference. But this is more natural, more simple. So they can try if they want. And if it doesn't happen, then you move on. But before doing it, we make sure all the conditions, you know, are fulfilled for the successful IUI treatment. That's what it is, Laura.
So what time is it tomorrow? I'm just having a look. 7:30 tomorrow. You've got your webinar. So you're going to be speaking about all those things. So if anyone wants to join, head over to Harley Street Fertility Clinic's Instagram or their website, and please sign up and speak to them tomorrow. That'd be great.
Correct. Yeah. We will explain everything in detail tomorrow.
Brilliant. Another question from another follower. How do we make the most of our first appointment with you? What would it be helpful to already know or understand that will help us get the most from the appointment? So they want to bring as much information to the table as possible. What would you advise for them to be ready to share with you to get the most out of your first appointment?
Very good. That's good. It's a practical question. You're right. So if anybody has any medical history, that some treatment before or some investigations, say somebody had a severity of the endometriosis. When was it done? What's the operation? Did they remove it? Or sometimes NHS will say it's not severe, so we are not doing anything about it. So I need to know how severe it was. Did they remove it? And how was it? How it affected the person? And then, and if the GP did some of your hormones, it will be useful to bring it so that we don't have to repeat everything. Yeah. And whatever you have already done, why should I waste your time and money doing it? So we will do only things which are not necessary. And the other thing is, other thing I would say is some people don't think about the donor. I mean, they all want to know about the donor. That is true, because they don't know how to start and where to start. Yeah. They should think about whether they want to use known donor or anonymous donor, because it has its own advantages and own disadvantages. In fact, I wrote a chapter in one of the books about pros and cons for using a known donor versus an anonymous donor, because then there are advantages, there are disadvantages. It's all depends on the personality, what you want in life. Yeah, that is why we say that be aware of this and decide what you want to do. But only thing I would like people to be aware is a lot of people are not aware till they come. Because if you have a known donor, the known donor has to be tested, the sperm frozen, retested. So there is a quarantine period with HFE, and now after freezing, they have made it say 6 months. So we can't do the treatment before that. And because if someone is 41 and 42, then you don't have much time to wait. Whereas the donor from the clinic or the sperm bank, they have already been tested. And they are cleared, so you can use or start the treatment straight away. So think about the time you have to wait if you are going to use the known donor.
If they do want a known donor, because they can have that conversation and say, okay, if we get you tested now, we'll have to wait 6 months until we can actually start treatment. But then again, that might be a positive, because they might need to do lifestyle changes with smoking, drinking, exercise. They might feel they need to lose weight. They might feel that they want to change their diet plan. So that's sometimes a positive as well, because it gives people time to make the changes that you as a clinic would say, you need to do this, this and this, and then go ahead with treatment. So it could be a positive as well, couldn't it?
No, it is. You have to prepare your body. It gives you time. But that's why I say, look, come well before you want to have a baby, because then you can prepare your body well, prepared. Meanwhile, that sperm donor is prepared and everything is done for him. So we are not wasting time. We are doing things in parallel. That way it is good, we can prepare. So we will know. And whatever information you have about your, periods and everything, that will also be helpful so that we can assess. And that's all. And if you have any questions or anything, please note them down. Because when you see the doctor, you think, oh, I forgot everything. Yes. And later on, you have questions in your mind. So I'm happy to answer, or any of the doctors in our clinic will be more than happy to answer this. We also have donor coordinator, and who will sort of arrange all the practical aspects and tell you other non-medical details of the treatment and everything. So she's happy to see the patients face to face and spend time, and there is no charge for such consultations or email or even Zoom consultation. If people are traveling from over long distance, We try to reduce the number of visits to the clinic, particularly more important now with COVID-19. But even before, we were getting patients from Birmingham and Manchester and other places.
Wow.
And even Southampton and Portsmouth and all, and Brighton. Yes, we get patients, so we always try to do lots of things when they come to the clinic so that we reduce the number of visits.
That's really helpful. What I like is that you said about cycle tracking. So it's something that when we speak to people in our support groups or people come to us for advice, we always say, if you're looking to start treatment at any time, whether it's at home or whether it's for a clinic, start tracking your period, start tracking your ovulation, so that when, like, you come to the clinic and they say, when do you, on average, how long is your period over the last 3 months? What have they been? Or 6 months? When do you ovulate? Do you know? A lot of women and people don't know when they ovulate. I know I didn't when I started treatment years ago. So it's really important to come, like you said, with all that information to say, okay, I know when I ovulate, I know when, how long my cycles are, they've been this for the last 3 months, this is how heavy they've been or how light they've been, this is the donor we want, known or unknown. So then you go, great, okay, all this information, and it's a really, really like positive appointment. So for that person that answers that question, it is really crucial to come with as much information as you can.
Correct. That's helpful to the clinician to help you. That is the main thing. Bring all the information, and because sometimes it's not this group, I'm not talking about anybody, any patient, sometimes they say, oh, I left all those notes, medical records in my house, doctor. I'll bring it next time. I said, oh God, it would have been useful, this time. Sort of go through your history to know what's happening. And so it's better. But we always remind the people when they book appointments, if they have any details of their medical records, past medical history, please bring whatever results you have. If you have done some test with your GP or even another private clinic, please bring them so we can make use of them. That's what we remind people. That will be helpful as well, Laura. Yes.
Perfect. Someone else has asked a question. We have had an offer for complete female fertility checkup. Is that something you do, that you do a complete package of all checks? Is that something?
Yeah, we do actually, because normally the female checkups involves a consultation to take detailed history about their cycle and everything. And we do an ultrasound scan and a blood test to check all their hormones, usually done between the 2nd and 5th day of the period. That is the ideal time. All these things used to cost 550 pounds before. Now, recently, after this COVID-19, we are doing a package, fertility package. It is only 350 pounds. So it includes the initial consultation, scan, blood test, and a follow-up consultation like this Zoom, so that we can discuss their results and discuss treatment options also. So that we do, and they can make use of this offer and, benefit from that.
Of course. And if anyone does feel that they want to reach out to the Harley Street Fertility Clinic and find out more about that package, please do reach out through their website or through their Instagram, and they'll come back to you. Have you got anything else that you wanted to share? I think you've given us quite a lot of information, and hopefully that will be really useful to people. But anyone that wants to come through, please go through the website, through the Harley Street Fertility Clinic Instagram, and you can speak to the doctor, speak to other clinicians, and they'll be happy to help you.
It's a great pleasure to take part in this program, and I hope people will come and see us. We can help them make their journey better for them.
Brilliant. Thank you so much for joining us, and hopefully speak to you soon.
Thank you, Laura.
Thank you.